morning and welcome to November's Connecting Knots. I'm Becky Sutton, Director for Community Health Services, and lovely to see so many of you with us today, whether that be live as part of Connecting Knots or in a pre-recording. You're very, very welcome. We've got a fairly packed agenda today, all sorts of different speakers. We're going to be talking about our digital strategy, we've got freedom to speak up, and we've got our smoke-free service giving an update. It feels like a little while since we've had Connecting Knots. We didn't have one last month, so just wanted to reflect back on the great AHP event that we had last month around AHP Day. There is a support worker day coming up that we're going to be celebrating as an organisation next week. Also I can't say we've got 2 weeks left to hear your views around this year's staff survey, so we're doing really well, and thank you to everybody that's completed their staff survey so far. This will be a theme of this morning. We're keen to hear the good, the bad and the ugly in terms of what you've got to say and how that feels working for Knots Healthcare today. So really encourage you to do that. As part of the session, as I say, we've got a few updates. We have got 2 question and answer sessions as part of this morning's Connecting Knots. That was in direct feedback from yourselves around people have questions after a couple of speakers, and often the momentum's gone by the time we get to the end of the session. So we'll have a couple of updates, then we'll come back to myself for question and answers, and there'll be an opportunity again for that later on in the session. So please put your questions in the chat, and as always we will try and answer them as best as we can. So without further ado, I'm going to hand over to Paul Devlin to give an update from the Trust Chair. Thanks, Paul.
Thanks very much, Becky. Morning everybody, Paul Devlin, Trust Chair here. The AHP Day, it was a great day. I was privileged to spend a bit of time with some of our AHPs and also have some conversation through a Q&A session. Really good. Just wanted to mention a couple of bits. A couple of weeks back, we held a board meeting face-to-face, obviously very carefully structured, but it was the first time since January 2020 that we'd actually been able to meet in a room together, which was really good to do. Couple of shout outs. I want to recognise that we're in Trans Awareness Week at the moment, so it's an opportunity for us to celebrate with our trans staff and volunteers and service users, and also just to have a bit of a shout out for our transgender service, which is a great service and is continuing to grow. I know doing some recruitment just at the minute. We're also in Disability History Month, so again opportunity to celebrate with staff and volunteers who have disabilities, and to be reflecting on how we can be a really good employer for people with disabilities, and also think about our services too. And I just finally just give an underscore around the staff survey. It's really important. We really value getting your feedback and your input, and particularly thinking about the free text as well. Please do use that. We make sure all of that free text is read and considered, and we seek to act on it as well. So that's all from me, and I think I can hand straight across then for our first slot from Cathy Fulloway on digital strategy. Cathy, over to you.
Lovely, thank you, Paul. Hello everybody, I'm Cathy Fulloway. I'm Chief Digital and Information Officer, and as our health informatics strategy has come to an end this year, we've been working on putting together our digital strategy to cover the next 4 years. So I've got some slides. Am I still doing the next slide please thing? I think I am. So I've got about 8 minutes to whiz you through this, so I'll go at some pace. So next slide please. Okay, so first of all, we had a look at what we already knew. So as Paul mentioned, there's some free text in the staff survey. Last year, there were 2 questions that were free text, and there was lots of mention about technology in there. We also looked at the KISS survey that People and Culture had run, and we've looked at what's come in on trends through our IT service desk and feedback from our colleagues as we talk to them in services right across the trust. We also looked at the national direction and the regional context, so what the integrated care system needs and what NHSX needs, and they've issued recently 7 measures for what good looks like in terms of digital. And we also made a survey available across all of staff that John mentioned in his briefing, and we consulted with the divisional digital groups. So next slide, please. And from all of that feedback, the themes and messages were pretty consistent. So people love technology and the ability to work from anywhere now. And they want to embrace technology, but they do want better IT systems, better Wi-Fi. They want their IT systems to be fast, reliable, consistent. There was lots of talk about giving patients equipment and data so that they can actually use digital solutions. So people just want the tools to do the job and fewer systems to sign into. Next slide, please. So the overriding messages out of the feedback was that our mission should be to provide digital solutions that help improve people's lives. And our aim should be to have fit for purpose and fit for use systems, information and processes that enable staff and patients to use data and technology to the greatest benefit to them. Next slide, please. And we looked at everything that had been talked about and where we want to get to. And there's 4 objectives we need to focus on in using technology and information. So we need to use that to enable smarter and safer working throughout the organisation. We need to digitise our health and care records so that we can share information quickly, appropriately, securely, and improve health outcomes. We need to provide public-facing digital services so patients can contribute and see their information. And we need to understand our data and its context to be able to make those informed decisions that improve patient care and population health across where we serve. Okay, next slide, please. And in delivering those objectives, there's a number of things that we need to get right to make sure that we can support both the digital solutions we've already got running and the things that we want to do, the transformation projects that help you redesign your services. We need to make sure that our culture is around digital first and a digital mindset when we're approaching change. And we know that not everyone has the skills or feels comfortable with digital, so we need to provide some support and education. And our infrastructure, that's the IT that all this sits on, that's got to be right. And also how the suppliers who are providing us products like Rio and System 1, how they change their products needs to be aligned to what we need to try and do. So we need to influence them. There's what we call business intelligence, which is about being able to interpret our data to make good decisions. And then wrapped around all of that is the leadership, the clinical engagement that we need to do, and also the clinical safety, because things have to be both cyber safe, but also clinically safe. Next slide, please. So we're coming from a place where we've made loads of progress. You know, our patients have now got access to Wi-Fi, our systems are more secure. We've introduced electronic observations, both mental health and actually some physical health observations. We're starting with News 2. We've introduced a portal for clinicians so you can see what's happening at NUH, Sherwood Forest and the council. And we've introduced lots of smartphones over the last 18 months or so to make sure that people have the tools to do their job. But we're now moving to a place where we need to deliver the strategy. So we need a whole stack of action plans. And you can see on screen some of the things that we're going to be focusing on, at least initially. And then as the years go on, we'll redo those action plans and make sure that we've got plans for what those 4 years look like as we get funding available. So next slide, please. We're going to do all of this overseen by the Digital Information Programme Board. We're going to make sure that the culture's right, the engagement's right, that we're as efficient as we can be, and we've got the right foundations in place, and all those projects happen. And last slide, your help. We need to make sure that you're involved. We know how important listening and engagement is, and we've been running user experience task and finish groups, and we'll soon be doing some polls on how you can influence what's in those action plans and how can we make IT better for you. So look out for that and get involved. And there's also a movement we need to start on getting the skills and the information out there for how we use digital. So we're going to start up Let's Get Digital. And if you're interested in being involved in that, then please get in touch. Let me know. You can become a digital champion and help share that knowledge. Thanks very much. I'm now going to hand over to Simbi, who is up next to talk to you about freedom to speak up.
Thank you, Kathy. And good morning, everyone. I'm Simbi, and I'm the Freedom to Speak Up Guardian for the Trust. So my role is to support staff to raise concerns whenever they feel that there is something getting into the way of providing good care. I provide an independent service to staff, confidential. So I'm here today to speak to you about, could I have this next slide, please? My first slide. I remember the last time I was on Connecting Notes, I didn't manage to mention everything I wanted to. So today I hope to start with the most important so that I don't run out of time. I'm not seeing my slide yet. Not yet. Is it coming? Freedom to Speak Up slide, please. Right. If there's an issue I can share from this side, Jenny, I'm not sure what's happening.
Maybe just start off without them, Simbi.
Okay, yes, sure. But it would have been good to have the slides on. Oh, I won't be able to share, will I? My slides from this end. Okay, so I thought because of time, what I wanted to focus on today, there's some tech issue with the slide. So I wanted just to highlight some of the work that we've been doing and the impact that it's making, and obviously to raise awareness about freedom to speak up and why it's important. So some of the work that we've been doing recently, we've just heard, I'll start by mentioning, as I said, I want to start with what I think is most important to shout out about. So we've just heard the highest number of speak up concerns raised. I'm told that these slides have been sorted. Let me get back. Yes, okay, that's great. Thank you very much, Jenny. So can we have the next slide, please? So this month, October gone, in October, we just had the highest number of concerns raised through the Guardian ever since Freedom to Speak Up Guardians began. We had 31 cases brought to me, to the Guardian, which is a very high number. We normally get this number as a total for the quarter, but we have heard what we get in a quarter in one single month. Now, you might want to say, is that good, Simbi, or is it bad? I would like to say it's both good and bad. Why? I'm going to say it is good if people are using the speak up route and are coming to speak up to the Guardian, because it shows that they are aware that there is freedom to speak up and that they can use it. And also because it's within our organization, we can make improvements, learning can happen. So it is a positive. And also it's good in the sense that it will lessen we hope that there won't be need for staff to speak up externally, as in having to go to CQC, if the trust can address the issues that are being raised. So there won't be any need for staff to go to CQC. So I think it also improves our staff health and well-being, because we are able to speak up about what's worrying us, what's concerning us in our job places, and things can be looked into. However, maybe it might be bad in the sense that we might want to think, is it that people can't speak via their managers? That's why they are coming to the Speak Up Guardian. Maybe that might be. Oh, maybe we might say, is it an indication that a lot is happening within the workplaces? Just as you can see on my graph, if you can see very well. So in October, we have had lots and lots of concerns raised around attitudes and behavior, which means how we relate to each other. And a lot of these, if I'm being honest, they have been around leadership and management and how people feel being managed. And I would like to say that the trust is being very responsive with these concerns and trying to look at, management development and supporting managers to do better. So these are some of the concerns that we've been getting. Can we have the next slide, please? So the other thing that's been going on, it's about we from the beginning of this year, 2021, we had a review of our Freedom to Speak Up function, how our Freedom to Speak Up operates, and which helped us to look at what areas need to improve, etc. This was some piece of work that was commissioned by Dr. Julie Hankin before she left. She had asked if the NHS improvement could help us to look at reviewing our Freedom to Speak Up. So we had that work done, which was a great piece of work because it helped us to focus on what else we could do. I haven't got time to tell you what the recommendations were in total, but I will be able to tell you some of the things that we have done as a result of some of the recommendations that came out of the work that we did with NHS improvement around the review. So we are trying to strengthen our communication with workers. We are using social media, we are using CEO updates and increasing our champion visibility. We now have a Freedom Speak Up Facebook group, and I think some of you are seeing a lot of Freedom to Speak Up within social media. We are also using Twitter, etc. So that is helping, and our champions are doing great work. We have managed to expand our champion resource such that we have 50 trained champions. When I started in November 2020, we had 13 Freedom to Speak Up champions who had received training. Now we have 50, and we are trying to keep it there as 50. Although some drop, we continue to recruit, especially for areas where there are no champions. So we are also that goes with my last point about the work we are doing in expanding the resource dedicated to Freedom to Speak Up in terms of champion resource. And our trust has also seen the need to have an assistant guardian. So I am very excited because the work is huge and we are going to have another guardian. This just shows the importance that the trust places on Freedom to Speak Up. We have more work to be done, especially with helping maybe managers to play their part to create a healthy speaking up culture. And there's a lot of support going on about that. I know that some of you will be saying, we brought this to you, we have raised concerns about this, but most of these are being looked into. Can I have the next slide, please? And then the other thing that's been going on is the Inclusive Freedom to Speak Up. I think I've got 3 minutes. I'm watching my time. Inclusive Freedom to Speak Up project. Our trust was chosen to pilot a project on Inclusive Freedom to Speak Up, which is kind of like a national, but there were 3 trusts that were chosen, and we were among the 3. I haven't got time to give the context or a lot about the national view about this, but in terms of our trust, as you can see on my middle graph there, it's just showing a picture of how speaking up according to ethnicity is within our trust. Most of BME staff, Black and ethnic minority staff, have not been raising concerns through the Guardian either, and I don't know if they are speaking via the managers, but the number of concerns that I was getting, very, very small. So there was a need to do that, as you can see on the graph. So we have had 4 workshops in September. We did some work again with NHS improvement from September to, from July to September. And then in September, we had 4 workshops in which were attended by 73 members of staff, mainly BME. This is something we hope to do with, across the trust, and especially looking at staff with protected characteristics to just look at barriers to speaking up amongst this group. Can we have the next slide, please? got 2 minutes. So what's been going on again through this Inclusive Freedom Speak Up, we managed to get a lot of insights into what we need to improve, and a lot of what was said is not just only about that particular group that we focused on this time, but it's something that's transferable across all our workforce. But I'll share with you some of the positive things that we got out of that. We did a poll, and out of 43 respondents that we had on the question of would you go to raise concerns about safety or other issues that impact you, majority of colleagues said that they go to their managers. As you can see on the graph, I don't know how visible, but 34 members of staff out of the 43 said they would go to their managers. I've got 1 minute, so which is really good that staff are feeling that they can speak to their managers. Can I have the next slide, please? I've got 1 minute. And also, how do you feel? Do you feel confident that your concern will be taken seriously? 26 respondents said that they feel confident that their concerns will be taken seriously, which again excites me that perhaps the staff survey results this year hopefully will be as good as it was last year, because we were the 6th most improved nationally. Can I have the last slide, please, and try to finish off now? The last thing that has been going on, the Speak Up Month, again, all these activities that I've mentioned, I think they've built up to why we had such a high number of concerns brought to the Guardian in October. We did a lot of work around raising awareness in Freedom Speak Up Month, October. You can see on the picture there some of the things that we have been doing. So it's been great, and thank you for the support. We've been promoting e-learning during that month, and we've been promoting the staff survey as well, because the staff survey is a great way of speaking up. If you didn't know, you can speak up through the staff survey, speaking up anonymously. So I'll just end up by saying, if you have any concern, please speak up, and speaking up takes many forms. It can be just, you're raising a concern or you're raising a grievance. It's all speaking up. I don't know if I can finish the last. No, I can't. Okay, just put on the next one, please, so that I can see if I can just sum up on that, the last one. Next slide. Right, okay, it doesn't matter. I've always been saying about this, how you can speak up. All this information, if you go on Speak Up website, there's information about how you can speak up. And also, if you go on Need to Know, there's a lot of information about Freedom Speak Up. Thank you for your time. And if I've left anything that you're very keen to find out or to know about, please get in touch with me, and I'll be happy to answer any of your questions. I'll now hand you over to Becky. I think it's question time. Thank you.
Thank you, Simbi. Great, lots to cover. You did well to keep within, and I know Simbi is very, very passionate about freedom to speak up. Some excellent results of what we're seeing, but clearly more work to do. So, Simbi, thank you for that, really helpful. And also thank you to Kathy to giving us a whistle-stop tour of the digital strategy, but again, more of that to come. So time on the agenda for questions and answers. As so far, we haven't had any questions through. So just encourage you, you can use this opportunity to ask any panel members or any of the execs any questions. We will have a moment in a bit later in the agenda after the next speaker for more questions and answers. So just encourage you to use this as an opportunity to ask us what you would like, or to ask some of the guest speakers to elaborate on some of the subjects you've heard this morning. Please just post the question in the chat, and we will answer all of those questions that get put in. Okay, so thank you. So we're going to move on now to the next bit of our agenda. I'm going to hand over to Lisa Evans, who's going to talk to us about all things smoke-free and some of the great initiatives that are going on at Notts Healthcare. Thank you, Lisa.
Hi there, everybody. Good morning, and it's a pleasure to be here to discuss smoke-free and just give you a brief overview of what we're doing. Next slide, please. So within the Notts Healthcare smoke-free team, we're a small but we're a mighty powerful team, and we adopt a multifaceted approach to our service, which includes training, support, projects, and working extensively with our external partners. I'm also going to touch on what's next and our comms strategy as well. Next slide, please. So for training, we have been identified as an example of best practice with Public Health England and with ASH, and we've actually split it into two distinctive parts. We have got the staff training, and we also deliver training to patients. So for staff, we've got our bread and butter training, which is very brief advice and nicotine prescribing guidelines and the use of e-cigarettes. But more recently, we've also now developed specialty modules, which include maternal health and smoking, cannabis, mamba and crack cocaine and tobacco. And we've actually coined the phrase now, if you can smoke it, we'll teach it. And also following the latest Stonewall report, which highlighted that there was a higher prevalence of smoking within the LGBT community, we are delivering a webinar on the 2nd of February addressing smoking and inequalities within the LGBT community. And this is being co-produced with our EDI colleagues. And top of this, it sounds gimmicky, but bear with me, we're calling it Cup Dates. And this is being filmed on the 29th of this month. And the theory is grab a cuppa, click on a module. There's going to be short, snappy modules that are going to be uploaded onto YouTube. For patients, we deliver training during the ward community meetings on the physical and mental health benefits of stopping smoking. We take along the different types of NRT, explain to patients how it's used, and look on an individual basis of which one is the best for them. And we also discuss addiction, because as you know, smoking isn't a lifestyle choice, it is an addiction. And also co-deliver with our substance misuse colleagues from City and County, substance misuse, tobacco and addiction. And this is delivered directly on the ward again to staff and patients. Both courses are really well received. And on the back of this, we are getting patients, not just supporting them with harm reduction, but supporting them to quit. Next slide, please. So support available for staff and patients. So for patients, we have a smoke-free advisor who goes around all the wards and speaks to our newly admitted patients and checks on their care plans what support is being offered in terms of NRT. On top of this, we're trialling a new e-cigarette across a couple of our acute wards in the next few weeks. Unfortunately, it has had to be postponed because of production issues and they're coming from abroad. We also offer face-to-face support for patients and staff and signpost our staff and patients, specifically patients post-discharge as well, to the local stop smoking services. We also work with our health improvement teams as well in the community so that we can support our community patients. And we've changed our the way in which we deliver this now, so this support for patients, so that we mirror the Greater Manchester maternity model. And what this means is that whilst the health professional is in the patient's home, we will actually make that referral and make that appointment before we leave the house. Our team will then go in and support that patient whilst we're waiting for that appointment and then check in with them at various times. For staff, we are offering face-to-face support. We also offer us one-to-one drop-in sessions on Teams, and we now have peer support groups as well, which is fantastic. They start at the end of this month. From Stoptober, we had in excess of 35 staff stop smoking, and we're following their journey as well. Next slide, please. So projects with external partners, I'm really excited about these. We've got some great work coming up in the future in the next few months. So Kick the Habit is the first one, and that's working with external sporting partners and our local stop smoking services. And we're utilising sport as a vehicle to discuss addiction and provide the NRT at half time and the behavioural support. It's going to be an evaluated study. It's one of the first of its kind. And going forward, once we've evaluated the study, we're hoping to also use this for other different types of addiction as well. Nottingham Big City Quit is going to be rolled out from the 10th to the 21st of January. And this is including our external partners. We're using the prostitute outreach worker bus, and we are going to go into 5 different hard to reach populations, including serious mental illness, our BAME communities, domestic violence refugees, rough sleeper and homeless, and prostitute sex workers. And depending on which population we're working with on that particular day will depend on which health professionals we have on the bus on that day to offer our support. So for example, when we're working with rough sleeper and homeless, we will obviously have our stop smoking services for the community there, but also be including then wound care from our trust and also our external partners like the Hep C testing. Okay, so fall back in love with your heart. Okay, bit gimmicky again. We love a gimmick in our smoke-free team. So 14th of February, we're working with our partners at Nottingham University Hospitals. We'll be in reception and A&E, and we are going to be offering smoke-free support with our external partners at this time. If any of these projects going forward that you would think might be of interest to you and you'd really like to know more and get involved with, please get back in touch with us and let us know. Next slide, please. So what's next? We're a bit busy, like I said. The NHS long-term plan. For this financial year, we are compliant. We have become an opt-out service. For the next financial year, looking at NHS England and the way it's going, it's looking like our focus is going to be on outpatients and community, as well as the inpatients. We have already put our plans into the ICS system, and we're waiting on the funding what we're going to be receiving from the ICS and NHS England. Also, NHS England have identified our system as one of 10 in the country which will be receiving funding to fully support and fund staff to stop smoking as well. So if we have any staff on the line who would like to trial an e-cigarette or to actually come and have a chat with us, please get in touch. We're also expanding the service across the trust, and also have recently taken on the alcohol and weight management elements of prevention for the long-term plan. You may have noticed in the last week, it's Alcohol Awareness Week, and we have got stands across the trust. Next slide, please. Okay, so for comms, you may or may not know that we're quite lively on Twitter and also have our own staff Facebook smoke-free page. You can email us at smokefreenot. And coming soon as well, we should hopefully be on other social media sites, and we just keep in touch with it, keep an eye on that as well. That's everything on our smoke-free service for now. Thank you.
Thank you, Lisa. What a great presentation, and really, really great to hear about some of the stuff that you're doing. Sounds like you're into all sorts and everywhere and anywhere that you can be to send your message. So a super presentation, and thank you. So going to move on to the next bit of our agenda. Really exciting to reward our staff around positive stars. So you're going to see a video in a moment for our latest positive star, who is Angela Bell, district nurse, and was presented her award by Anne-Maria. And we're just going to watch a short video, I believe, around Angela and her positive star.
Hello, I just wanted to say I'm very excited. I'm just about to head out to give a positive star to a member of our staff. She doesn't know, it will be a surprise, one of the community teams.
And I'm really pleased to be with you as well, Anne-Maria, and I'm really looking forward to surprising this member of staff.
Is our Exec Director of Nursing, and Paul Devlin, who's our Chair. So they've got a special presentation that they'd like to make today. So, Angie, let's come forward, please.
So, there's a real joy for Anne-Maria and myself and colleagues when we get opportunities to hear about some really positive stories from staff, and you've been brought to our attention, Angie. And there's a couple of bits, and I think they reflect some really interesting pieces about our values. So first off was just recognising you've been involved in a pretty complex safeguarding situation recently with lots of challenges in there, and you ended up having to attend a MARAC meeting. I did have a quick check-in with Anne-Maria. What on earth is a MARAC meeting? I now understand that in terms of the multi-agency risk assessment conference. So that's going into a space where I'm guessing you've got a load of other people, probably most of whom you either don't know or they've got names you recognise. And your colleagues were telling me how well you presented that case, really articulated it well, with confidence, and that patient, as a result, has started to attend social events and is actually enjoying living, which is a real impact. And you know, if that wasn't enough, I mean, that to me is real compassion, and also some of that teamwork and engagement piece. But alongside that, what I also got told about was you on your way buying petrol. Now there's a thing that we shouldn't even think that that's such a big thing to do, but you were. And you saw there was a woman who had collapsed and seemed to be semi-conscious and actually was having a fit. And she banged her head in the midst of that. And you know, you being you, and again your compassion and your focus on people, you made sure that patient got into a recovery position until an ambulance came along and was able to then take her to the services she needed to get to. So, Angie, on the back of those two examples, and I'm sure your colleagues here could come up with a load of others for us, what we'd like to do is present you with this month's Positive Star Award.
No tears, no tears. So it is with my greatest pleasure, as your Executive Director of Nursing, that I am handing you this Positive Star. You have to know, it makes me extremely proud when I've got nurses like yourself who are doing such jobs as you're doing. And it's great. Okay? Thank you. All right. So we'll have a
Oh, what can I say? It's been a whirlwind of the last nearly 18 months since I qualified as a district nurse, but every day that I come to work with this amazing team just makes it special. They're absolutely amazing, and I won't want to do it with any other team. They're not just a team, they're like part of my family, and I can't do it with just myself. I do it every day because of these guys. We all work together, we're in it together, and that's our motto for the team, and that's what we do. We're amazing, and I can't do it without you guys, so thank you. So this is for everybody.
Well done, Angie. What a great video. I love the secret squirrel effect of Amaria and Paul surprising people for their positive stars. So look forward to seeing some more of those in the coming months. But absolutely fabulous, and even more fabulous that he's one of my team. So well done, Angie, on that Positive Star Award. So just moving us to the question and answers. We thank you very much. We have had a couple of questions in around some of this morning's speakers. So the first one I'm going to move to is there's a couple of questions around the IT strategy that you heard about earlier on. So I'll read the questions and then hand over to Kathy to answer both. So the first question we've had relating to the strategy is, as a trust, how will we ensure that we are not worsening health inequalities in our service users in relation to those who are at risk of or who are experiencing digital poverty and exclusion? What a fantastic question, and I'm sure Kathy will give us a great answer. And then there's a supplementary question around how can people find out more about the progress of the digital strategy and what's happening across the trust. Kathy, thank you.
Great, thanks, Becky. Yeah, they are really good questions, aren't they? And the first one on that sort of digital inclusion, exclusion, you're absolutely right. There is a danger with health inequalities, isn't there, that we make things worse as well as better and widen that gap. So there's been quite a bit of work in the integrated care system across Nottinghamshire already. So the council have commissioned like an external third sector partner to help give people equipment and data that they need to get online. And we've got a digital inclusion group that the trust has, where we're putting lots of thought into actually how do we do that, and how do we get that equipment to the right people. And we're obviously using our data. So we're looking at health inequalities and checking on what the outcomes are where we are using digital solutions, and thinking through how do we identify those populations that are most vulnerable. So that's on that one. And obviously, whilst we are going to use digital solutions, we'll never get rid of the ability to see people in other traditional ways. So there's a thing about patient choice in there as well, isn't there? On the second point, if you need to know about what's happening on the digital transformation projects, already where there's things happening on projects, you can sometimes find information on Connect. So for example, if you go to Connect, you can see what's happening on our electronic prescribing project at the moment. Every division has a digital group. So if you get in touch with the people who head those up, Pip Dean does it in Community Health Services, Kezia Foster in Adult Mental Health, and Adele Fox in Forensic Services, and they can give you more information. We will put out information in John's briefing when there's things that are useful to know across the whole trust. And if you want to become a digital champion, then get in touch with me, and then we can talk about how you can be part of spreading that word amongst your colleagues and getting that information and helping distribute it. Thanks, Becky.
Thank you, Kathy. So some great answers to those questions, and lots of opportunities now and down the line to get involved in our digital strategy and also our digital journey. So again, encourage people to come forward. We need people on the ground to help drive those messages and help be part of the solution as well. So thank you for that. So next question we've had in this morning is around our ICS. So as a trust, we are invested in the ICS, bringing together health and social care organisations. And the question is, what's coming up? What's the landscape? So just a simple question there. If anyone that knows anything about the ICS, so I'm going to hand over to John to give an answer from his point of view around the ICS. Thanks, John.
Hi, thanks, Becky. Morning, everybody. Great session, thank you. So I don't know how long I've got, probably not very long, to a pithy couple of sentences on the integrated care system. So what's happening is, in simple terms, the ICS, which people are increasingly talking about, currently isn't a thing. That from January will become a shadow thing, and from April will be written into legislation and statute and be a thing, or an organisation or an entity, and will have responsibilities to oversee and coordinate all the healthcare provision in the county of Nottinghamshire, like across the rest of the country. So we're one of 43 ICSs. So there'll be some familiar things like a chair, a chief executive, and some key executive posts which are currently being appointed to. A recent panel has made a recommendation that Amanda Sullivan will be the chief executive. She's currently accountable officer for the CCG. And from April, the CCG will no longer exist, and those functions of commissioning are currently being worked through, again, against the national templates. Some of the higher level strategic commissioning functions will stay within the ICS body. Other functions will be devolved into other organisations, trusts, providers within the ICS. So an example of that is something called provider collaboratives. So ICSs will have a number of provider collaboratives, which is essentially providers working together across traditional organisational boundaries, providing sustainable services that provide better outcomes that are much more centred on focusing what patients and service users need. And if it works, those are the sort of things that will happen. So access will be improved and better. That trusts and organisations will be more sustainable. The quality of patient experience will improve, and outcomes will improve, and efficiencies will be made. Of course, there's a counter narrative to that goes, this is just another transformation that will not make any difference, blah, blah, blah. But we travel forward, don't we, in hope and in optimism. And the important thing is that it's not something other to us. We are a core component of the ICS. You know, we're the second largest trust in the county, and we've got a huge contribution to make, not least because we've got brilliant staff and we've got vast experience in the things that we provide and run. We've got huge expertise and professionalism, and it's down to us to help make it work and fly. That's it in a nutshell. There's a huge amount going on. I know many people are involved, and we'll continue to keep people updated, particularly with what opportunities come our way. Hope that is that a helpful sort of summary. Thanks.
Thank you, John. A great summary, and great to sum it up. As we say, there's a lot going on, whether that be around changes in how we do things. But I think it's a really exciting time, and some of the work that I'm involved in community services is really exciting about how we work together with our partners. And I think it's that move from competition to collaboration, and you know, there's a real opportunity to embrace some of that. So that's great. So last question before we move on the agenda. So the next question we've had was directly around Lisa's presentation and all the exciting work that her team's doing. So question around, why are you still called Smoke Free if you're doing other important things like weight, alcohol, etc.? Are you planning to change your name? So over to Lisa to respond to that. Thanks, Lisa.
That made me giggle because it's so true. Yeah, it's a great question. I think the challenge we've had is because we've only just recently taken over the other elements of prevention, and it's coming up with a good name that our staff can actually remember, because it's all right calling it something, you know, out there and stuff. It's got to be something that the staff think, oh yeah, that's who I need to call when I need some help or support. So for example, with Smoke Free, we have staff contacting us all the time because it's easy, they can remember our name. So if anyone can think of a name for our team that, you know, we did think healthy hospitals, but actually we do work in hospitals, but we also do a lot of work within the community. So I'm throwing down the gauntlet now. If anybody can come up with that name for us, it'll be really appreciated. Let's see what we can do.
Thanks, Lisa. So a bit of a competition and a bit of a challenge to our staff out there. A short and snappy name for Lisa's services that incorporates some really, really important things, and absolutely going to be key going forward. So we've set that gauntlet down, come up with a snappy name. Thank you, Lisa. So far we haven't had any more questions in this morning, so I'm going to move us on to and hand over to John, our Chief Exec, to give us a bit of an update from his perspective. Thanks, John.
Thanks, Becky. I know the people that run the organisation have kindly given me 3 minutes for this, but can I assume that I've got a little bit longer? How long have I got? What, about 8 or 9? Yeah. So the first thing I just wanted to note this. I thought, Lisa, your presentation was brilliant, and I thought, and the reason I thought that, not only the content of what you described of what you're doing, because it's really important work, but increasingly I get asked by various people, whether it's regulators or people that look at what we do, they ask a really good question. John, are your services inclusive, and are they culturally tuned into the services that people need? Which I think is a really good question. But Lisa, I think without prompting, I would say that if people wanted evidence or an example of a service, of services that are culturally appropriate and inclusive, you describe those really well. And I'm sitting there thinking, wow, that's you really hitting the nail on the head of the sorts of things that we need to focus in on. So recommend that clip for people to look at, but also to say thank you to Lisa and her team for what they're doing, because I'm sure it's making a huge difference to a lot of people's lives. So to the message first, in terms of things that I'd want to say, is about all things COVID. and the pandemic. We appreciate that things remain very challenging. There's an awful lot on the demand for all our services across the trust, and the acuity or the how unwell people are when they're hitting our services is high, challenging. We know we've got some real significant issues with maintaining our rosters, staffing our wards, and that it's really stretching. So it's important to acknowledge that and to say a huge thank you personally, but also on behalf of the executive and board for everything that everybody's doing, and please pass that on to your peers and your colleagues. I'd like now to be able to say, and you know what, it's looking like it's all going to be fine by Christmas and New Year, but unfortunately, you're clearly aware that that's not the case. These are the hard yards. These are the tough times that we've got to dig deep. We've got to focus on supporting our staff to be the best they can, to use our values to help inform how we help people, and to say thank you, to be kind and to be compassionate. And so really difficult times right across the health and care system. So thank you to everybody for what they're doing. I just wanted an update on the vaccination intelligence that's coming down the line. You'll be aware that the announcement about making COVID vaccines mandatory from the 1st of April, which will mean that to have received 2 doses, I think it's either the 3rd or the 6th of February next year is the deadline to enable that to happen. Understandably causing anxiety for some of our staff, but the really good news about vaccinations, we've done really well, that about 95% of our staff have been vaccinated. That's a huge achievement, and again, just wanted to recognise that and say thank you to everybody that's availed themselves of the vaccine. Really important part of how we can protect ourselves and our patients and service users. There's a wealth of increasing information around the benefits, but also the potential side effects, the hazards, what to watch out for in around the vaccines that are available through the staff wellbeing team on Connect, and we're always happy to arrange conversations with people if they're still hesitant or unsure or anxious about this. But the other thing to say about it, that headline rule that's coming in, there's a lot of work behind that we're still not informed about. So we're getting a number of questions, aren't we? For example, what about people that are shielding? What about women that are pregnant? How will this impact? So when that's been worked through and we get that detail, we'll communicate it out to make sure that we keep everybody as updated as soon as possible. And if you could just bear with us until that's worked through. And we do appreciate again that these are potentially anxious times, but for those few percent that are still thinking they might get the vaccine, it's available. You haven't missed the bus. There's still opportunities to get the jabs if you change your mind. And the teams currently are busy working on the boosters, and the school age immunisation team are working on the 12 to 15-year-old cohorts too. Sticking with needles. Just to mention, it's also the flu vaccine season. Again, something that is really important in terms of making sure that the eligible people get their vaccination. We're doing okay in terms of uptake. It's available right across the trust, and it's easy to find out where you can get your jab. It's really important. Again, we're just starting to enter the flu season. There was very little around last year, which means that there is a susceptibility to much higher numbers. And if you get both together, it can be really impactful on your health. So look up for that. Thank you for those that have already had their jab. And then very briefly, just a couple of things to finish on. I don't think I've been on 5 minutes. I've not mentioned National Staff Survey. We're entering the final furlongs, people. This is the gold-plated, platinum sprayed, jewel encrusted response rate trophy that this afternoon I'm going to the impact team in adult secure services to present them with their prize for the week. They've had the most improved response rate and have actually achieved 100% response, which is phenomenally good. As a trust, we're at about 50%, which is good, but we've got about 8 days to beat last year's total, which was, I think we had a 54-55% response rate. It'd be great if we could just push those final figures. It's totally anonymous, as you know. It really helps inform our plans and how we continue to improve staff experience. We were the most improved trust nationally last year in terms of a good place to work and receive care. So any last people you can encourage to get it done, because I'm sure everyone on the call has filled theirs in. It only takes 10 to 15 minutes. Really, really valuable, and it's the most valuable feedback I get. So I do take it personally, although it's not personalised. And there's the opportunity for free text as well. It's not just a tick box. And we're nearly there. That trophy, you keep it for a week, but that will go for a year to the team with the best scores. So all is not lost if you're thinking, oh, I don't know. I think probably, Becky, that's as much as I wanted to say. Huge amount going on, really great session. Really enjoyed the inputs from Kathy on the digital. That's a really important piece of work for us as a trust. That the ever effervescent Simbi and the brilliant work that we're doing now collectively in the freedom to speak up space. Again, it's critically important as we become an organisation that's happy with ourselves, that's creating the right environments for people to work in. We've done a lot, there's still a lot more to do, but going in the right direction. And as I say, Lisa's prevention stuff is fabulous. So that's all from me, and thanks to everybody for their inputs today and for what they're doing. Back to you, Becky. Thank you.
Thank you, John. A great update as always, and I think this morning will be how many times can we get the staff survey in to every segment that we're talking about. But the reason why it is so important to feel how people are, how it feels to work at Notts Healthcare. Tell us how we can improve. We can't do anything if we don't know about it. And I personally take it really seriously, take on board everybody's comment. And we've already in our division made lots and lots of improvements off the back of what people said last year. So keep it coming. It's really, really important. So we're coming towards the end of our Connecting Notts this morning. To echo John's point, it's been a great morning. Lots of different updates from various people, just shows how much is going on within the organisation, but also lots of themes around really wanting to listen to our staff about how we make digital better, opportunities that they can speak up, but also ways they can access services to make them healthier going forward. So excellent work and some really, really good updates. So finally, just to say, we look forward to seeing you again in December. I think we've got a slightly different Connecting Notts for December, more around a celebration event, a thank you event leading up to Christmas, and that's mid-December. The dates will all be advertised on Connecting Notts. So again, encourage as many as people possible either to free themselves up to watch that live or to watch the recordings afterwards. So really no more to say than to thank all the presenters for this morning, thank all of those of you that have attended and that are likely to watch this recording going forward, and a great big thank you for everything you do every day to keep our patients safe and our services safe. Thank you.